Well, hey, everybody, this is Robert, and welcome to this Outbreak newscast. We'll be going to the continent of Africa and the country of Ethiopia. And Ethiopia is reporting an increasing trend in malaria since late April, according to the World Health Organization. Since the beginning of the year, there has been more than 2.3 million cases of malaria and over 400 fatalities in Ethiopia. Cases have been reported from 14 regions, with the Oromia region being the epicenter of the outbreak. And in this area, 40% or the majority of all the cases have been reported, which number more than 69,000. Amhara region follows with about 44,000, or about a quarter of all the cases in the country. Just during the week ending June 8th, 177,561 new cases and 38 reported deaths were reported, and 96% of the cases have been confirmed. Nearly two-thirds of the cases are caused by the very dangerous Plasmodium falciparum, while the other third were due to Plasmodium vivax. Ethiopia's susceptibility to malaria epidemics stems from its pronounced climatic, topographic, and demographic disparities, influencing the risk of malaria across different regions. Typically, malaria peaks occur between September and December following the primary rainy season, from June to September, and then again from April to May after the secondary rainy season. Now, there's a bunch of public health actions being taken to get this epidemic under control, and here's a small portion of it. It's not all inclusive. The Ministry of Health and the World Health Organization are coordinating on this epidemic response. The surveillance network has been revitalized in high burden, conflict affected areas and non functioning health facilities to ensure comprehensive coverage and timely detection of malaria cases. Healthcare workers have been trained in malaria case management, as well as the production and distribution of malaria treatment guidelines and other job aids. Access to malaria diagnosis and treatment has been enhanced by deploying mobile health teams and establishing temporary treatment centers in conflict-affected areas and for internally displaced persons and refugees. Now, the procurement and distribution of anti-malarial drugs to healthcare facilities has been stepped up, focusing on the last mile to ensure accessibility. And some issues that are going on in Ethiopia that are hampering the response and the disruption of malaria elimination activities are mainly due to the ongoing conflicts in the country, the influx of refugees, climate change, and the instability in the health governance contributed to these massive outbreaks. Now, according to the World Health Organization, malaria is a life-threatening disease spread to humans by some types of mosquitoes. It is mostly found in tropical countries. However, it is preventable and curable. The infection is caused by a parasite and does not spread from person to person. Depending on the species, symptoms may be mild or they could be life-threatening. Mild symptoms are fever, chills, and headache. Severe symptoms include fatigue, confusion, seizures, and difficulty breathing. Infants, children under 5 years of age, pregnant women, travelers, and people with HIV or AIDS are at higher risk for severe infection. Now, malaria can be prevented by avoiding mosquito bites and with medicines. Treatments can stop mild cases from getting worse. Malaria mostly spreads to people through the bites of some infected female Anopheles mosquitoes. Now, blood transfusion, contaminated needles may also transmit malaria. The first symptoms may be mild, similar to many febrile illnesses, and the difficulty to recognize as malaria. Left untreated, Plasmodium falciparum malaria, the species that's causing about two-thirds of the cases in Ethiopia, can easily progress to severe illness and death within 24 hours. Now, there are 5 Plasmodium parasite species that cause malaria in humans, And two of these species are the greatest threat, the two that are found in Ethiopia, Plasmodium falciparum and Plasmodium vivax. Plasmodium falciparum is the deadliest malaria parasite and the most prevalent on the African continent. Plasmodium vivax is the dominant malarial parasite in most countries outside of sub-Saharan Africa. The other malaria species which can infect humans are Plasmodium malariae, Plasmodium ovale, and Plasmodium knowlesi. Thanks for listening.